Good day, friends, and a warm welcome to our talk show, our Vitamin D talk show. And today is a special day because we have two guests, not one. It's even more special because these two guests are special for each other. Now, it's famously been said women hold up half the sky. That is true. But then men hold up the other half of the sky, is it not? If men hold up half the sky and women hold up half the sky, who holds up men and women? Of course, it's their bones and muscles. So, if we need a strong sky, if we need a strong earth, then we need strong men and women. And what's the vitamin? What's the hormone of strength? Let's find out. So, a warm welcome to our duo, our dynamic duo for today, Dr. Manoj Chawla and Dr. Purvi Chawla, both from Mumbai, dynamic diabetologists and pharmacologists. And they work very hard to spread diabetes awareness across the country. A warm welcome, first of all, to Dr. Manoj Chawla. Warm welcome, Dr. Manoj.
Hello, evening everyone, and very good evening, Dr. Sanjay.
Dr. Manoj, so women hold up half the sky and men hold up the other half. Who holds up Dr. Manoj Chawla?
When I was listening to that introduction, I was remembering um, Israni's dialogue from Sholay. It was almost seemed to like कि आधे इधर जाओ, आधे उधर जाओ, बाकी मेरे पीछे चलो. So I was wondering the introduction that you're doing. So as always, a very interesting insight and an introduction into what we have for today. Well, I think it's for many of us, it is the uh, inspiration from many others like yourself, which drive us to hold and keep holding us up in doing every aspect of activity that we do. And personally, I think um, it's the passion to do more which holds us up. Though I must say the bones extremely important, and the muscle which we all begin to lose after a while. But that aspect of sarcopenia conversation, I think we'll leave for another day. So
Sure.
thank you again, Sanjay, for having me here.
Our theme for today's talk show is gender specific aspects of vitamin D. So, would you like to share with us more insights, more information regarding vitamin D in men? We always speak about women's health, but then men's health many times gets short shrifted. So, over to you, Dr. Manoj.
Thank you. Yes, so I think I will take the liberty of sharing a presentation also and quickly going through the role of vitamin D in diabetes with certain male related specific aspects, how it may get affected. So let's start with understanding the numbers. Every time we have a conversation on diabetes, we start with the epidemiological numbers. Diabetes affecting 1 in 11 adults in India. More than half of adults with diabetes remaining undiagnosed. India, of course, ranks second globally in the number of people with diabetes. Well, you have a large number. In fact, the number listed here has again been overridden with the new numbers presented recently in the Lancet. We have more than 100 million people with diabetes and another 130 million with IGT, adding to the magnitude of the problem of people with diabetes. We look at what is the connect between vitamin D and diabetes. We did speak about for every individual to stand tall and stand straight, to be supported by good bones requires good amount of vitamin D and calcium. But there's also more metabolic impact of vitamin D, which just goes beyond bone health. Well, it clearly vitamin D deficiency has been linked to both insulin resistance and metabolic syndrome, and has a bidirectional link both with obesity as well as with type 2 diabetes. So, enough studies have shown that low vitamin D is inversely associated with the incidence of diabetes. The hypothesis that vitamin D may influence the risk of type 2 diabetes is also plausible, and various in vivo in vitro studies have proposed potential roles of vitamin D in both aspects in reducing the insulin sensitivity as well as affecting the pancreatic beta cell secretion and functioning. Well, mechanism of action, though it may seem a little cluttered and difficult, but on simple fronts to understand that various environmental factors like sedentary lifestyle, insufficient exposure to sunlight, low dietary supplements, all of this teamed up with epigenetic changes which happen because of our lifestyle, whether it is also affecting the vitamin D receptors, the cytochrome P270B1, uh, various gene polymorphisms specific, especially to the vitamin D and CYP27B1 receptors, is somewhere impacting the role of vitamin D. All of this again leading to reduced insulin sensitivity and impaired glucose metabolism. And at some point, also evidence suggesting that this could lead to destruction of pancreatic beta cells, create an environment milieu of inflammation and systemic inflammation, increasing the chance or prevalence of development of diabetes. So, prevalence of vitamin D deficiency. Well, studies in India have revealed varying rates of vitamin D deficiency, which ranges from 30 to 100% in different surveys. I remember some of the surveys done even in younger population in schools in Delhi, and which has shown the prevalence to be as high as 60 to 70% there. Community-based studies conducted over the past decade have indicated a prevalence of vitamin D deficiency in India ranging from 50 to 94%. A cross-sectional study at single center in North India found a prevalence of 55.5% for vitamin D deficiency and inadequacy for 38.46. What is deficiency? What is inadequacy? We'll throw some more light on that. The Endocrine Society of India recommendations for vitamin D is that amount of vitamin D a person really needs daily to prevent a deficiency depends on age. So they believe that most adults would require about 4,000 international units per day. And the best way to prevent vitamin D deficiency is to ensure getting adequate amounts of vitamin D from the food that you eat or from dietary supplements, because um, sometimes even just the best food that you may eat may not suffice. And of course, sun exposure. And when we talk about sun exposure, it actually means at the right time. It's not any time of the day, ideally between 12 noon and 2 p.m. If you're going to be exposing your upper part of the body to sunlight at least for 45 minutes to an hour, that may give you sufficient exposure to sunlight, which again in many parts of India with a poor air quality may actually affect the exposure to sunlight even if one attempts to sit in that manner. So we look at vitamin D status and diabetes risk. This is a paper published earlier in the American Journal of Clinical Nutrition, which spoke about the association of vitamin D deficiency with incidence of type 2 diabetes in high-risk Indian subjects. So what they found was among the participants in the study, 10.5% had deficient vitamin D levels defined as less than 10 nanogram per ml. 51% were insufficient, which was between 10 to 19.9 or 20, and 38% were found to have sufficient vitamin D, which is more than 20 nanograms per ml. The incidence of type 2 diabetes decreased with increasing vitamin D levels. And if you adjust this for various factors, those with vitamin D deficiency had an increased type 2 diabetes risk, independent of the BMI or the HOMA IR levels and the insulin to glucose index. Hazard ratios were again found as 2.06 for the insufficiency, inadequacy levels of 10 to 19, and 3.23 if it was less than 10, which means deficient, compared to levels which is found adequate, which is more than 20. So clear evidence published across multiple studies. I've just quoted one of them here. The impact of vitamin D supplementation on glycemic control. So in fact, because there is a clear link between vitamin D deficiency and insulin resistance, the moment you start supplementing vitamin D, it has been shown to improve HbA1c levels, reduce insulin resistance, and overall requirements of insulin in the short-term intervention. Oral supplementation of vitamin D showed an association with enhanced glycemic control. Purely vitamin D supplementation is also shown to reduce A1C from 7.29 to 7.02%. Fasting plasma glucose anywhere in the range from 31 to 102. Postprandial from coming down from 196 to 135. And of course, improving other metabolic parameters in individuals with diabetes. So achieving normal vitamin D levels through supplementation does hold promise and as a beneficial adjunctive therapy. And that's something that we've seen as a trend in the last couple of years, where we've realized this connect with vitamin D. and physicians, endocrinologists, diabetologists across have been making use of vitamin D supplementations as means of great adjunctive therapy for managing diabetes. What about vitamin D and complications of diabetes? Well, vitamin D receptor is ubiquitously expressed. Experimental in vitro and in vivo studies have strongly suggested a role in regulating the transcriptions of multiple genes beyond calcium homeostasis. And these include the anti-proliferative properties, immunomodulatory, angiogenic, inhibition of the RAS system, and the neurotrophic factor expression. So you do see this connect between vitamin D and the complications. So vitamin D and diabetic neuropathy. Well, vitamin D has been linked to the regulation of neurotrophins such as the NGF and neuronal calcium homeostasis. Well, both of which would be play a neuroprotective role in peripheral nerve. So we're now looking at the connect of vitamin D beyond just the bone health point of view and the connect with neuropathy. Studies have shown that actually for somebody with neuropathic pain, correct supplementation of vitamin D can reduce the pain by 50%. High dose vitamin D therapy was also associated with reductions of inflammatory markers like interleukin 6 and interleukin 10 concentrations, showing improvement in severity of neuropathy and skin microcirculation. A single intramuscular dose of 6 lakhs international units of vitamin D was associated with significant improvement in painful neuropathy. Also, importantly, when we talk specifically to male health and male sexual health, there is a connect between vitamin D and male fertility. Diabetes itself is one of the biggest contributors to male sexual dysfunction and infertility, especially the sperm quality and the function. Patients with diabetes have a high prevalence of subfertility reaching 51%. Among those with type 2 diabetes, the prevalence of infertility in men is 35%. Individuals with diabetes experience significantly elevated rates of both primary and secondary infertility compared to those without diabetes. And secondary infertility surpasses primary infertility among diabetic patients, which means there are secondary causes which can actually be tackled and hence should not be ignored. Around half of infertile men with diabetes are overweight, with 29% classified as obese. So, again, uh, being overweight, obese, metabolic syndrome, all of these are further contributing to their infertility. Well, so this was a study which looked at investigating the role that vitamin D plays against testicular lesion in diabetic rats and to try and find possible mechanisms of steroidogenesis and spermatogenesis. In diabetic rats, prolonged hyperglycemia evaluated inflammatory cytokines, damaged sperm production function, and redox balance, along with looking at serum testosterone levels. What they found was, following 12 months of treatment with two different doses of vitamin D, all alterations which were found initially were effectively normalized. Vitamin D exhibited inhibitory effects on excessive inflammatory biomarkers and regulated the expression of reproductive genes and testicular androgen synthesis. If upregulated, the BCL2 expression decreased the BAX and the COX2 expressions and inhibited the active capsase cascade, potentially preserving testicular cells under the diabetic condition. So, a lot of pathways which are involved in the steroidogenesis and male testosterone production were affected in the correct manner. Conclusions: vitamin D supplementation may protect cells by suppressing inflammation factors and alleviating apoptic cell death. It also regulates the expression of genes related to reproductive and testosterone hypothesis. So, vitamin D and diabetic kidney disease, several factors. So, we look at now, we saw neuropathy, we saw male infertility, and we look at the connect with diabetic kidney disease. Several factors contribute to pathophysiology of DKD, including metabolic abnormalities. We know diabetic kidney disease is something which is prevalent in almost 50% of people with diabetes today, different stages of DKD. Hyperglycemia is a major contributor to dysregulation of the intracellular metabolism, the inflammatory pathways, an increase in cell apoptosis and tissue fibrosis. Here again, a reduction in the cytochrome P27B1 activity occurs in kidney disease, which subsequently inhibits the production of vitamin D and impairs its absorption. So clearly, DKD and vitamin D deficiency again go hand in hand. Excuse me. A significant decrease in the vitamin D levels is observed when the GFR starts falling and has been seen to be low below an eGFR of 40 milliliter per minute or less. Patients with diabetic nephropathy were given 50,000 international units per month of intramuscular vitamin D or a placebo for 6 months. Patients in the treatment group exhibited a significant reduction in the urine albumin creatinine ratio, and an increase in GFR of up to 7 ml per minute was seen compared to the placebo group. There was some non-significant reduction in USCR with patients with type 2 diabetes with albuminuria with vitamin D deficiency who received the zero point 0.5 micrograms of calcitrol daily for 8 weeks. So the eGFR improves, the USCR has reduced but non-significant reduction, but clearly benefits of vitamin D supplementation there. You look at vitamin D and fracture. Well, counsel individuals with diabetes to manage their calcium and vitamin D, and that's one of the important parts today of a holistic 360-degree management of diabetes. Ensure vitamin D intake to meet the recommended daily allowance, especially if they are at risk for fractures, utilizing either dietary sources or supplements. And personally, as much as we may recommend, I think dietary sources or even sunlight exposure doesn't help to the extent that we would like, and very often we have to land up using supplements, which we can discuss later. While the optimal level of 25 hydroxy vitamin D remains debated, it is crucial to know that diabetes poses a risk factor for fractures. Alternative guidelines propose aiming for a target of more than 30 nanogram per ml for 25 hydroxy vitamin D levels, and you require about 40 to 60 nanogram per ml for the same, considering the increased fracture risk associated with diabetes. So, clinical approach to managing vitamin D deficiency, again, screen the patients. If you find them to be either, they may be asymptomatic, they may have symptoms, um, getting the vitamin D levels, diet adequate in calcium and vitamin D with sunlight exposure should be one of the recommendations. And then, based on the levels that you find them to be either inadequate or deficient, you initiate the once a week vitamin D supplementation. Largely, we believe that a 12-week therapy of 60,000 international units would be a better means of doing it. Uh, a lot of countries recommend your daily intake of 2,000 international units, but for those who are uh, deficient or inadequate, we would look at supplementing the easier ways through 60,000 units per week, at least for 12 weeks, and then continuing with a maintenance dose of 60,000 once a month. And then you could do a follow up vitamin D levels to see how they are maintaining the therapeutic vitamin D levels. So let me conclude by saying that vitamin D assists in regulating insulin secretion and glucose metabolism, enhancing the body's insulin response. So there are multiple ways to improve insulin sensitivity. Vitamin D replacement is one of those. Vitamin D does contribute to modulating inflammation and oxidative stress, both implicated in diabetic complications. It is advisable to screen individuals with elevated A1C levels. I would say even those with normal A1C levels, it's important to screen them for vitamin D insufficiency in today's times. Normalizing vitamin D through supplementation shows potential as an adjunctive therapy for patients with type 2 diabetes. The ADA recommends maintaining serum vitamin D levels above 30 for diabetes patients to reduce the risk of fractures. And I think that's the kind of level that we are also happy seeing. Anything less than 30, I at least tend to provide the supplement to these patients. So with that, let me again thank you for joining in, and we can stop my presentation and move back to Dr. Sanjay to take this ahead. Thank you.
Thank you, Dr. Manoj. So you've highlighted not only the musculoskeletal, but also the fertility related aspects of vitamin D when it comes to men. Uh, the hashtag for this year's International Women's Day is Inspire Inclusion. That was their hashtag. So it would be nice if women could include men in their health related initiatives as well. With that, let's welcome our second speaker, Dr. Purvi Chawla, who is a renowned clinical researcher and diabetologist. Welcome, madam. Yeah,
Good
welcome,
evening,
madam.
sir. And thank you so much for that warm welcome. And yes, we just celebrated International Women's Day, and my message would be, as someone who sees metabolic disorders every day in women, I think inspire inclusion, but prioritizing yourself would be the best. So I wonder how many women really get their vitamin D levels checked every year or from time to time and see if they are sufficient or not.
Hmm. And that's right. That is a very valid point. So women actually hold up more than half the sky because they take care of not only themselves, whatever time they have to do that, but they also take care of the entire family and that way the entire society. Dr. Manoj has spoken with us about the uh, aspects of vitamin D related to men. But what about women? Do women have a special need for vitamin D for focus on bone health? And does that vary across the life cycle, all the way from menarche up till menopause and beyond? So, Dr. Purvi, the floor is yours.
Absolutely, sir. Very well said. It's actually the different phases in a woman's life which makes it even more imperative that they focus on vitamin D, because it's the single most important vitamin that is so crucial at every stage of their lives. So, yes, without much ado, I think that was a wonderful overview on the role of vitamin D in diabetes in men. But I think equally important, or even more important or crucial, is in women, because we are not even paying any attention or focus or spotlighting on the deficiency in women. And even though we talk so much about it and so many initiatives are taken to increase the awareness, the numbers are so dismally high that I think this is a single most correctable factor, and we must do what is required to change this scenario. So let me walk you through the presentation I have today to highlight on the role of vitamin D in diabetes in women. Next, please. So we know that yes, more than a billion people worldwide are suffering from vitamin D deficiency, arising from a variety of socio-cultural factors besides the dietary habits as well. First of all, low exposure to sunlight. We're all getting more and more indoors and losing the adventure and being outside itself. Again, in certain cultural practices, there is the habit or custom of wearing long sleeved clothes and completely covering themselves. So that also increases the rate of vitamin D. The use of sunscreen has gone up. Of course, we need to protect ourselves from the UVB light, but at the same time, that is causing more and more of vitamin D deficiency. As age advances, there is vitamin D deficiency noted, and low consumption of food containing ergocalciferol, which actually helps in the last step of vitamin D formation, and then malabsorption syndromes, and even certain other post bariatric and other situations where there may be vitamin D deficiency. So, because of a myriad of reasons, as you can see, vitamin D deficiency across the world is increasing. And again, the role of vitamin D earlier was only associated with skeletal problems and rickets and falls and osteoporosis and osteomalacia. However, we know that the role is way beyond that, and it actually impacts many, many, and almost all aspects of one's health. And metabolism or metabolic disorders often stem from vitamin D deficiency. So, diabetes or insulin resistance states like PCOS, etc., are all related with vitamin D deficiency, also obesity, metabolic syndrome. So, that's a lot of overlap, but it's all there's one common factor which has been noted as vitamin D deficiency. So, and again, we saw in men too that there is a role in diabetic kidney disease, or there is a role in osteoporosis, or there's a role in neuropathy, and many other aspects which impacts women as well. But over and above those which have already been discussed, in women, there are specific phases where we need to pay even more attention to vitamin D deficiency. Next, please. So, diabetes in women, again, the numbers are staggering, and I'm not going to read out these numbers. We all know that there's at least 50% of the prevalence of diabetes in India is in women, and maybe some uh, age groups there is more men than women, but women have more risk factors and are associated with more even death and other aspects or disability because of diabetes. So, a study conducted in 2019, for example, has indicated that as compared to men with diabetes, women have faced at least 13% higher risk of death from all causes, 30% higher risk of death from cardiovascular disease, and 58% higher risk of death from coronary heart disease. Next, please. And vitamin D status and diabetes risk in women. Again, to look at this association, several studies have been conducted, but I'm just going to quote this one to determine the association between 25 hydroxyvitamin D concentration and the risk of incident type 2 diabetes. In this nested case controlled study, that among 608 women with newly diagnosed type 2 diabetes, and comparing that with control subjects, almost 559 control subjects in the nurses health study, the association between baseline plasma 25 hydroxy D concentration and the risk of incident diabetes was measured. And after they adjusted for all the confounding factors like say BMI, it was found that higher levels of plasma 25 hydroxy D were associated with a lower risk of type 2 diabetes. And this was association was consistent across the subgroups of baseline BMI, age, and calcium intake. So, irrespective of all these other confounders, there was a very strong association that was learned, and that helped us reach the conclusion that plasma 25 hydroxy D concentrations were associated with a lower risk of incident type 2 diabetes, especially in women. Next, please. Now we come to a very, very important aspect of a woman's life, which is childbearing or pregnancy. Research from developing nations, particularly like India, indicate that an exceptionally high prevalence of vitamin D deficiency among pregnant women has been noted right from 70 to 100%. Excuse me. And this is quite startling that almost all of our pregnant women are deficient in vitamin D. In fact, individual studies have pointed as high a prevalence of vitamin D deficiency in all the metros, whether it's Delhi or Bangalore or Mumbai. And that again is quite indicative of how neglected this particular aspect is. This deficiency is widespread among women in the reproductive age group, spanning rural as well as urban areas and cutting across various economic classes. So, this has percolated everywhere in every social strata and economic strata. And it just shows us that why today's talk show with Dr. Sanjay Kalra and Dr. Manoj is so important. And I thank the organizers for bringing this topic to the fore. Next, please. Vitamin D and gestational diabetes. Now, again, a significant association between vitamin D deficiency and an increased risk of gestational diabetes has been observed. The lowest risk of diabetes related with pregnancy was found among those with a serum vitamin D level of between 40 and 90 nanomoles per liter. Results of meta-analysis indicate that supplementing women with gestational diabetes with vitamin D may result in enhanced glycemic control and a decrease in adverse maternal neonatal outcomes. So, just to take this point forward, vitamin D deficiency in women has in pregnant women has been associated not only with neonatal adverse outcomes but also with immediate or acute complications in pregnancy like preeclampsia, hypertension, and gestational diabetes, all of which are really highly dreaded. Next, please. Vitamin D supplementation and gestational diabetes. Now, this particular study, they screened 110 participants, and of which 90 were enrolled, and or 100 were randomized, and 90 had at least one risk factor for gestational diabetes. Now, 50 were assigned to receive vitamin D, and 50 were assigned to receive placebo. In the intervention group that received vitamin D, they got 5,000 units of vitamin D daily, and the control group took placebo until the 26th week of pregnancy. And when I think of this, I feel that in today's times, we would not even be allowed to do such a study where we do not, we keep pregnant women away from vitamin D and give them placebo instead. It's that important. So coming back to the study, yes, 100 were randomized, 50 to receive 5,000 units of vitamin D daily, and the other 50 to receive placebo until the 26th week of pregnancy. And they found that amongst the completers in both arms, the prescription of vitamin D supplementation in the first and second trimesters of pregnancy was effective in reducing gestational diabetes. Significantly higher percentages of positive GTT, that is 34.8% versus our 11.4%, and GCT, which is a glucose challenge test, again 36% versus 11%, were observed in the control group. So you can see again, this has clearly proven that vitamin D does have a role, and its deficiency is associated with the development of gestational diabetes. Next, please. Thus, the recommendations in pregnancy should really be focused on. It is supplemental vitamin D is considered safe up to 4,000 international units per day during pregnancy or lactation. According to the American College of Gynecologists recommendations, if vitamin D deficiency is detected during pregnancy, a daily intake of 1,000 to 2,000 IU is considered safe. The Institute of Medicine report suggests that a daily intake of 400 to 600 IU per day of vitamin D can be solely achieved through diet alone. And this most experts in the field definitely feel that this is a very low intake that IOM has suggested. So we go by the Endocrine Society recommendations, which includes daily intake of 1500 to 2000 IU of vitamin D, aiming for a target of 25 hydroxy D levels of more than 30 nanograms per ml. And it is also said that maintaining it between 40 and 60 nanograms per liter is per ml is what is recommended during pregnancy. So we go by the Endocrine Society recommendations of 1500 to 2000 IU of vitamin D. Next, please. Now, coming to another important phase of a woman's life, which is completely non negotiable, right? Every woman goes through menopause unless there is death before that. So this is non-optional. It's just a eventuality that every woman does have to face. Vitamin D plays an important role in regulating the growth and maintenance of various types of epithelial cells, including the ones in the vaginal tract. Menopausal women often experience a lot of GI or genitourinary tract issues like dryness or urinary incontinence. These two are prominent complaints that we receive from women, from our female patients in this age group. Adequate levels of vitamin D may help alleviate some of these symptoms by supporting the health of vaginal epithelium and potentially modulating even the inflammation that's present in the genitourinary tract during this time. Vitamin D is known to modulate even the immune function, both innate as well as adaptive immune responses, as it plays an important role in regulating the function of T cells, macrophages, etc., and helps to maintain the immune homeostasis. Adipokines, which are the inflammatory cytokines produced by the adipose tissue that are central in many physiological processes, including metabolism and inflammation, Again, vitamin D influences the production and secretion of adipokines, but the exact mechanisms are still are not elucidated yet. But we know that there is a strong association, and that was even seen in cases of neuropathy. There is evidence to suggest that vitamin D and its metabolites have anti proliferative effects on various types of tumor cells. Vitamin D may help regulate cell growth and differentiation, and it has been studied for its potential role in preventing and treating even cancer. Excuse me. So, looking at the vitamin D status pre and postmenopausal in diabetes women, hypovitaminosis D was more prevalent amongst the postmenopausal diabetes women, 63.8% versus 58.2%. Hypervitaminosis D was also significantly associated with insulin, HbA1c, and fasting blood glucose levels in only the postmenopausal women. So they impact the metabolic or metabolism or diabetes regulation in postmenopausal women even more. Vitamin D deficiency is prevalent in pre and postmenopausal diabetes women, but higher amongst the postmenopausal women, as we just discussed. Vitamin D screening thus should be incorporated into managing type 2 diabetes as an early tool for preventing vitamin D deficiency. But today we sometimes are resource crunched and we do not or we are not able to screen as much as we would like to. But supplementation is even more important than screening. Let me just give you that practical tip. Next, please. So, guidelines on vitamin D and postmenopause really say that healthy postmenopausal women may achieve adequate serum concentrations of vitamin D through either sun's exposure. They should expose themselves at least 15 minutes per day, at least 3 to 4 times a week, or supplementation with 800 to 1000 IU per day. To achieve adequate levels, women with low serum 25 hydroxy D may need doses ranging from 4000 to 10,000 IU per day. So we recommend that if they are healthy in the postmenopausal status, then adequate serum concentrations through either sun exposure alone or supplementing with 800 to 1000 IU per day may be adequate. However, with low vitamin D levels, women need higher doses of up to 4000 to 10,000 IU per day. Next, please. Again, these three important aspects are very interlinked: vitamin D, PCOS, and insulin resistance. So let's understand that insulin resistance and related hyperinsulinemia that is associated with it have been linked to all symptoms of the syndrome, such as reproductive disorders, acne, hirsutism, hyperandrogenism, which leads to all these, and metabolic disturbances. So, all the aspects of PCOS are coming from insulin resistance and hyperinsulinemia. And let's understand and that insulin resistance in PCOS is a risk factor for future gestational diabetes. And then we know that gestational diabetes itself is a risk for type 2 diabetes. So all this is like a continuum of dysglycemia, right from the younger age group to pregnancy and then even beyond that. And how is vitamin D at the center of it all? So, vitamin D or deficiency of vitamin D leads to lower release or secretion of SHBG or the sex hormone binding globulin, which leads to increased testosterone. And that is responsible for the hyperandrogens, hirsutism, acne, seborrhea, etc. And this is also an oxidative stress inducer. This, on the other hand, is also related with metabolic abnormalities like obesity, which further compound insulin resistance and create an oxidative stress situation. And that leads to decrease, and that is also is coming from decreased insulin secretion in relation with the vitamin D deficiency, which which increases the risk of reduced insulin receptors and increases insulin resistance again. It's also leading to a chronic inflammatory state in the body, which again is associated with increased oxidative stress. And calcium dysregulation is again closely related with vitamin D deficiency, and that leads to so many fertility issues and menstrual irregularities in these young women. So you see, vitamin D is right at the center of it all, leading to the conundrum, or leading to the entire spectrum of features in PCOS that we see. Next, please. So, a higher prevalence of vitamin D deficiency, excuse me, up to almost 85% has been observed in women with PCOS. And studies have also shown that vitamin D deficient patients have significantly higher body weight, BMI, testosterone, the LH hormone, and serum calcium as well. The study has concluded that screening PCOS patients for deficiency of vitamin D holds an important value because suitable replacement can be considered. Next. So the vitamin D dosage for consideration in PCOS women, again, it's women who with PCOS who received a daily dose of 4,000 IU over a period of 12 weeks w- showed notable decreases in the total testosterone and free androgen index also, along with elevated levels of SHBG. So just imagine that just supplementing them with a vitamin itself is giving us so many other benefits which we struggle to achieve in our women with PCOS. Next, please. Now, again, coming to vitamin D and diabetes related fractures, vitamin D is indispensable for calcium absorption and maintaining optimal bone health. Right? This is where we started. And there are studies or scientific evidence that indicates that women with diabetes face an increased susceptibility to osteoporosis. Maintaining sufficient levels of vitamin D can serve as a protective measure, bolstering both bone density as well as strength. Consequently, optimizing vitamin D levels may indirectly diminish the likelihood of fractures and musculoskeletal ailments. So often patients in their common language will say, how many aches and pains they have per day and how they have noticed that, when you give us those sachets to be taken once weekly, how they start feeling better. So this is all related to vitamin D deficiency, which when you supplement, patients are even symptomatically better. Next, please. So vitamin D and fracture risk in women. Again, women with vitamin D deficiency, osteoporosis, or even prior incidental fractures should receive adequate supplementation along with targeted bone preserving therapy. In the absence of other risk factors for low serum vitamin D levels, dose ranging from 800 to 1200 IU per day are recommended. Next, please. So, this is, I think, the last slide that managing vitamin D deficiency and a clinical approach to it. This is exactly what we discussed already. That the recommendations from the different associations are as given in the table. And generally, we can say we can go by the ICMR NIN recommendation, which says 600 IU per day in adult men and women, but 800 IU per day in men and women over 60 years. However, when we complicate the whole issue with diabetes, we need to supplement them adequately and for much longer, almost 12 weeks, so that the adequate uh, levels of serum vitamin D are reached. And again, the approach is pretty similar. We screen them, or if they are symptomatic with no signs, that may be vitamin D sufficiency, and then we can decide to supplement them once a week, of course, with an adequate dietary support. And if there is any need to reinforce, then of course, healthy diet, lifestyle adherence, and persistence with therapy should be continued. In case of symptomatic patients with signs and with other signs of vitamin D insufficiency, definitely once a week for 8 weeks should be considered. And we should look at the clinical and biochemical response in these cases. If it's satisfactory, then we continue with the maintenance of once a month. However, if not, then we need to repeat the entire course for 8 weeks again and then reassess. And once we are satisfied with the clinical and biochemical response, we can continue them on a maintenance. However, vitamin D deficiency we know has to be treated much more aggressively, and we should consider giving them 60,000 units per once a week for 12 weeks and then assess the clinical and biochemical response and follow the same pattern that we did for other two states. So, next, please. So, to give you some pointed messages, inadequate vitamin D levels contribute to obesity and insulin resistance, increasing the risk of type 2 diabetes itself. Adequate vitamin D intake during pregnancy reduces the likelihood of gestational diabetes. And remember, the Endocrine Society recommends 1500 to 2000 IU per day in a pregnant woman. Screening PCOS women for vitamin D deficiency allows for early initiation of replacement therapy. Women with diabetes are at an increased risk of osteoporosis. Maintaining sufficient vitamin D levels can help mitigate this risk itself. And incorporating vitamin D screening into the management plan for diabetes serves as an important early preventive measure against vitamin D deficiency. So, with that, I conclude my presentation and hand it back to Dr. Sanjay Kalra, sir.
Thank you, Dr. Purvi. Wonderful talk and wonderful, um, a very complimentary talk actually by both Dr. Manoj and Dr. Purvi. So we have a fair idea now of the overall need for vitamin D, but specifically about the special needs, the special requirements of men and women. We call this person centered care. Keep the person, the individual, at the very center of all your decision making. And here at Vitamin D Talk Show, our center of gravity is the audience, the people who are listening in. So, a warm welcome to Gangaji, who says namaste to you, Dr. Purvi and Dr. Manoj both. Swapna Jain, madam, is a renowned patient health advocate from Vellore in Tamil Nadu. Dr. Siddharth Dhanger is a dynamic diabetologist from Mathura in Uttar Pradesh. And Satarshi Darji says if there are so many benefits of vitamin D, then Dr. Purvi and Dr. Manoj, does it mean we should give vitamin D to virtually every adult living in India? So, Dr. Purvi, your take first, and then we ask Dr. Manoj.
So my take is that, like I already mentioned during the talk also, that we are sometimes faced with resource crunches. Wherever possible, we should screen for the levels. But if not, what I do is I just ask them verbally if they have been taking any supplementation or have they been given something by their, home physician or general physician or family doctor or what have you, and then just give them the supplementation. It's fairly it's a good assumption, it's a calculated assumption that there is deficiency that exists, and we can definitely give them the course of vitamin D to address the same. So yes, we should consider it. You can see that the prevalence of vitamin D deficiency is so high, whether it's urban or rural. It's more than 70 to 80% in our Indian population.
Dr. Manoj, earlier it was said that tuberculosis is every Indian's birthright. Would we be right in saying that today, because of the changing lifestyle, the pollution, so many things, vitamin D deficiency is every Indian's birthright? Dr. Purvi, your take on this? Do you feel that would be an apt descriptor?
Absolutely, sir. And there is a lot of evidence to also suggest that because of not only just repleting the deficiency, it's also the role of vitamin D in immunity itself that also helps combat, the response to TB.
Hmm.
I mean, the response to TB, and that's why we must definitely make sure that the patients who, with especially diabetes and TB, which is like a deathly duo, definitely need to supplement those patients.
In fact, the first Nobel Prize that vitamin D got the Nobel Prize even before it was discovered, because the prize was given about 110 years ago for the treatment of cutaneous tuberculosis. And what the researcher found was, from Denmark, he found that if you just take people to a sanatorium, give them exposure to sunlight, their cutaneous tuberculosis gets resolved. So it was actually vitamin D which was doing the trick.
Sir, I was
So,
just trying to recall this story itself when you asked me about tuberculosis, and very well quoted, so.
Dr. Manoj, a challenging question from Dr. Mukesh Makrolia. He says, normally we prescribe 60,000 units once a week. But supposing the vitamin D deficiency is very severe, less than 4, not detectable, we have those patients, and patient is symptomatic, then can I give 60,000 units every alternate day, maybe for 5 to 10 days, or 5 doses, or maybe alternate day? Would that be safe?
So yeah, interesting and challenging question. Though I have personally not used it. I have probably gone ahead and done twice a week in severe deficiencies initially. Um, Honestly, I'm not aware if doing it alternate days or 3 or 4 days a week to do that. I think even if it is severe deficiency, is it a situation which requires immediate correction by doing that? I'm not sure. So probably sticking to, if at all, twice a week for first few weeks and then going up to once a week will eventually build it up. Um, in fact, let me take it the other way. We do see a lot of overcorrection, especially with the injectable ones. And I have unfortunately seen the connect between over supplementation, especially with injectables, and hypervitaminosis D, leading to kidney damage and aspects there. Having said that, I haven't seen that with oral at all, but as I wouldn't probably be feeling the need to do it more than twice a week. Would love to know your experience as well, because I haven't come across this alternate days or 4 times a week.
Dr. Purvi, please.
So just to add, I have done this. I have supplemented patients every alternate day for about 3 to 4 times a week, especially during COVID, the COVID pandemic, when I had seen a lot of diabetes patients getting COVID and severely deficient in vitamin D. The support was that, they had recently done that entire screen of tests that you typically get from all these labs, where they do test for vitamin D and B12 and everything else. So with such evidence, I have definitely supplemented them when their vitamin D levels were so dismal.
Thank you. I myself have used it. From a women's perspective, there are protocols or suggestions which say that for women with premenstrual syndrome, you can give 5 doses every alternate day or every day in the premenstrual phase. And that has been shown to improve the symptoms of premenstrual syndrome as well. We should also be aware of verbiage. Verbiage means the kind of words that a patient uses to explain the symptoms of vitamin D deficiency. They may be specific, related to the muscular or the skeletal system, and they may be non-specific as well. So in general, patient will come and talk of pain. Patient will not say that I have vitamin D deficiency. And there's something called the Moan syndrome, MOAN, that is osteo arthro neuropathic. So patient coming and talking about pain, the pain can be muscular, it can be osteo in origin or bony in origin, it can be arthro or joint, and also neuropathic. In all of these, actually, vitamin D will act. To both the Dr. Chawla's warm greetings from Ethiopia, from an endocrinologist there, Dr. Armias Gebre Michel, and warm greetings, Dr. Gebre Michel, to you as well. Pavan Aluwalaji asks two questions. So the first one is, Dr. Manoj, could you please enumerate some good vegetarian and vegan sources of vitamin D and calcium both? We need to unmute.
I think again a good question. So, sorry, right?
Yeah,
Can I
perfect.
be heard?
Yes, yes.
Okay. So, well, typically the sources for vitamin D tends to be more non-vegetarian, so we usually talk about egg yolk and fish and other aspects. But the question pertains to vegetarian sources. One of the aspects that we can see is aspects of certain mushrooms. Just a sec. So, there are specific mushrooms which have been shown to be good sources. You have cereals, you have soy milk and plant milk based products, which actually may be helping as sources of vitamin D. You also will get it as in fruits like oranges and bananas, again, will be decent sources of vitamin D. So, if I have to sum it up, vegetarian sources, um, plant milk, oranges, bananas, mushrooms would be, and spinach again would be sources of vitamin D, though they are still poorer source of vitamin D as compared to the fish and salmons and egg yolk as the sources of vitamin D.
And
For
Dr. Purvi,
vegans, you also, yes, sir. So for
carry on.
vegans, you also have fortified, almond milk and soy milk. I've seen it will always have a box saying fortified with vitamin D. That can be selected for vegans. It is very tough to get vegans for vegans, especially from natural sources, because they will, not even eat cheese. As it is, it's a challenge for vegetarians, but even without that, it's a bigger challenge. So, look out for the fortified food stuff like rice milk or soy milk or almond milk, and also the cereals. That can be a good source of vitamin D.
Yeah,
Also, I've read somewhere that, lichen, the plant source, also gives out vitamin D, but I'm not sure how well it would be in, tasting it or
yeah.
stuff. Even seaweeds, I know I myself have bought them from the stores as a source of vitamin D also, but it's not palatable at all, sir. So I don't know whether to recommend that or not. And it's
It
not
would
easily
be
available in India.
it would be easier to take the pharmaceutical preparation. And Pavanji also asks, ma'am, can you tell us about the Dr. Purvi? Can you tell us about the pharmacology of vitamin D? They say it's fat soluble, and earlier we were taught that you have to take it with milk or with a fat soluble, with a fat rich diet. What has happened now? Now, why is it? What do the people do in the pharmaceutical factories? What is it that is done so that we can now take it with water and we still get the same efficacy?
So the formulations have changed over time, and clearly now we have formulations that are amenable to better absorption and better levels reached within shorter time. The PK, the pharmacokinetic properties have improved with these newer formulations, and they are also, that's with the micellar absorption, it's much easier to reach the recommended levels of plasma levels of or serum levels of vitamin D. But earlier, yes, you're right. Traditionally, it's even today, family doctors will say that दूध के साथ मिला के ले लीजिए या have it immediately after your food with uh, some source of fat, that will be it will help the absorption of vitamin D. But formulations today have gone way beyond that and are much better. So we don't need that particular recommendation.
Like Madam rightly said, Pavanji, the size of the particles has become smaller. Now they are able to make the vitamin D in smaller particles, nano-sized, and that can get absorbed across the intestine even without fat. Uh, there are more questions. Dr. Manoj, a question for you is coming from Ethiopia, from Dr. Armias. Is there a proven deficiency association between diabetes and vitamin D deficiency? That's one question. Secondly, when we work towards management, prevention of diabetes, what work are leading associations in India doing to focus on this, to focus on vitamin D sufficiency as a part of holistic diabetes health?
Sorry. So the first question was pertaining to connect between vitamin D deficiency and diabetes. Was that the?
Diabetes. Yes, that's
Yes.
the first
So
question. Second is, what are we doing about it?
Again, all bouncers coming up. So the first part is simpler. Yes, there is clearly a connect between vitamin D deficiency and diabetes, and I think I showed that in my presentation as well. Multiple papers published, which have shown both the connect in terms of prevalence of vitamin D inadequacy and incidence or prevalence of diabetes, and the other way around, supplementation of vitamin D improving the metabolic control and reducing insulin resistance. So a clear connect established. Having established that, I think what the associations are doing is awareness. So both physician and patient awareness. Today's initiative, today's conversation is one other such aspect which is being done. And these could be done by individuals with interest in spreading education. That could be done by associations like the Endocrine Society or the RSSDI. Um, is it's about creating the awareness towards essentially screening for vitamin D deficiency across the patient groups and then supplementing it where required. Um, Also, I think clearly there is also an awareness towards wherever possible fortification with vitamin D. Also, in terms of at larger population level, especially children, again trying to create awareness for vitamin D screening and sufficiency there.
Yeah,
So
thank you.
just to add to that, sir, the Indian Pediatric Society, I mean the Indian Association of
IAP.
Pediatricians, IAP, has also given out their recommendations, and the government of India is also taking a lot of massive strides in this field because they are quite aware that our population is already deficient and at a further risk of rickets, especially in children. So the midday meal scheme, or part of that Poshan Abhiyan, has also incorporated vitamin D, and it's either given free of charge also, and many schemes exist where they even fortify the foods that is given in these midday meals to children, school going children, where vitamin D supplementation is part of the entire program.
That's actually nice. And the same way that we have, every 6 months we have a deworming day in the country. So we can do these vitamins D supplementation days as well. And the way we've
True.
been able to eradicate polio, smallpox, so many other diseases, we can eradicate vitamin D deficiency. Speaking of eradication of vitamin D deficiency, let me take one question again from Dr. Gebre Michel. Vitamin D is a continuous, ongoing requirement. It's a nutrient. It's a micronutrient with a macro punch. So even if serum levels are optimal in diabetes, once a month there's no harm in giving 60,000 units. That will maintain the vitamin D. So it's not a cross-sectional; it's a longitudinal approach. The same way that we would have for blood pressure or glucose or weight control. Madam, one question for you, and this is polycystic ovary syndrome and vitamin D supplementation. So, Pavan Ahluwalia ji asks very sincerely, now polycystic ovary syndrome, we know so many things around it: metabolic, musculoskeletal, mood-related, mitogenic, and menstrual. Uh, any specific symptoms of PCOS that you think would improve with vitamin D supplementation?
So vitamin D supplementation and the study I showed you also clearly stated that uh, improving or supplementing with vitamin D has had a direct relationship on reduce or increasing the SHBG secretion, which reduces the testosterone levels, which means that the hyperandrogenism which exists in PCOS, and that gives rise to so many annoying symptoms in our young girls, the acne, the hirsutism, the sometimes the change in the voice quality, all those things will improve with vitamin D supplementation. But the D, and of course it will help those who are even trying to lose weight or making lifestyle changes to fight against the increasing weight in PCOS will also benefit from this supplementation. Besides, of course, some amount of dysglycemia or increased BMI that we may note in them. So the benefits are multifold, especially in our women with PCOS, but symptomatically, all these may be improved.
Thank you, and I'm sure that answers Mr. Ahluwalia's query. Uh, men and women, they say, are from Mars and Venus, but there are situations where we have things in common, and I think one of them is the need for the sufficient. Uh, Dr. Purvi, is vitamin D, uh, this is the last question for you. Is vitamin D sufficiency associated with happiness? Can we say that vitamin D is a vitamin of happiness in women?
Absolutely. And I think they named it rightly. It's not only the sunshine vitamin, but also one with happiness, because let's understand that a lot of mental issues or mental symptoms also arise, especially around the menopause time, when a woman probably has little more time to think about what's going on with her life. And there may be a lot of cognitive changes, not only because of the receding hormonal levels, but also because of vitamin D deficiency. And all this seems to get corrected and is associated with enhanced mood. So I am not in a position to quote a meta-analysis or anything at the moment, but it's a given fact, and there is enough scientific evidence to show that there is improvement in mood, happiness, affect everything with adequate or optimal vitamin D levels.
Thank you.
So
So we
if I
can
can just
call it the
if I
happiness
can
vitamin.
just butt in with what Dr. Kalra is suggesting, maybe this Holi, as Diwali is far away, don't celebrate sweets, but ensure you're distributing vitamin D supplements for the entire family.
That would be a great idea, actually. And if we can link vitamin D with our festivals, so that also brings an impact, that element of happiness. Dr. Manoj, I am reminded of this story where a king was unhappy. So, I mean, he was unhappy. So, because of that, the entire kingdom became unhappy. So, he called all the, all the Vaidyas and the doctors and the physicians. So, they spoke with him, they looked at him, they touched him, and then they came to the conclusion, you have to wear the shirt of a happy man. If you wear the shirt of a happy man, then you will become happy. So, he sent all his soldiers out, far and wide throughout the kingdom to find the shirt of a happy man. But all the soldiers got stuck because they couldn't find anybody happy. The entire kingdom was unhappy. Finally, in one remote corner of the kingdom, they found a guy who was whistling. So the soldier said, "Yeah, this should be a happy person. No one can whistle unless he is happy." And they went and found that person. He was a shepherd and he had no shirt. He was not wearing a shirt. Now, it would be kind of not so feasible to ask everyone not to wear shirts. But what else can we do? Like Holi is this wonderful idea, distributing vitamin D at Holi. Now you're a respected leader in the diabetes field. Would it make sense whenever you do your next uh, meeting to
So
serve
actually,
vitamin D supplement to everyone?
absolutely. So, great suggestion. And actually, we've done that. So, I remember a couple of congresses in the recent past where, at least for the physicians who often tend to neglect their own health, let's try and have the physicians happy. So, if your physician is going to be happy, maybe the patients are also. It's going to
Yep.
transfer that
Yep.
happiness onto the patients. We always love to listen to the fact when patients say, "Ki, doctor, seeing you itself makes us feel half better and half our illnesses go away," and things like that. So, as a physician, if you are going to be happy, your patients are going to be happy. And hence, having not just conversations on vitamin D at the conferences, but making sure that your kids and your delegate and the faculty kids have not necessarily just the paracetamol brand put in that, but the vitamin D as well. And I think that they did that at Apicon also this time along. Probably a prize itself was involved. So I think that's a great suggestion that we continue to do that. It's actually far more helpful than a letter pad and a pen or whatever which may be put in those kits.
That's a great idea, and thank you so much. So there is this Haryanvi proverb which says, "One plus one is not equal to two; it's equal to 11." And that's what we have today, Dr. Purvi and Dr. Manoj. One plus one not
We,
equal to two, but equal to 11.
we are getting more and more acquainted with the Haryanvi phrases as our son studies in Sonipat, Dr. Kalra. So we would love to hear more of the Haryanvi phrases from you so that we also can maintain the lingo with him.
Then Haryanvi songs are ultimate for everyone who is listening, and I'd like you to listen to this song called Paracetamol in Haryanvi. Now, there is a song called Paracetamol in Punjabi as well, but that's a
Is it?
problem statement. Yeah, it's a problem statement. The singer is quite dukhi, he complains about things. But our Haryani song is ultimate. So the guy sings to his lady love, "You are my paracetamol." And
Uh-huh.
what more can a lady want? So
So,
here, Dr. Manoj, who is your vitamin D before we
right.
conclude?
You have that song, you are my sunshine. I'm sure you heard that song. So that probably should change in the near future to you're my vitamin D, or whatever
That's
poetically we can rhyme it with.
who is your
I,
vitamin D before we conclude?
Well, you caught me in a situation right now. If you, well,
it has to be.
let me say the reflection in on the screen right now is my vitamin D.
Right. So with that
This is
wonderful
a
answer,
forced endeavor.
but with that wonderful answer, I'd like to thank both Dr. Manoj and his vitamin D, Dr. Purvi Chawla, for being with us today. A wonderful talk show. We've learned about vitamin D, and certainly we've learned that vitamin D is important for men, it's important for women, for everyone, and it's a happy hormone. It's a hormone of happiness and harmony. Today is the first day of Ramadan. We wish everyone who is fasting a very fulfilling, spiritually uplifting, and safe fast. And if you are fasting during Ramadan, do not forget to take your weekly vitamin D after iftar. That will actually help you with not only musculoskeletal but also happy health. So, with this, I'd like to thank everyone. Jai Hind, everyone. And we hope to be with you again.
Thank you, Ramadan
Jai
Kareem,
Hind,
and Jai
sir.
Hind.
Thank you
Bye
so
bye.
much. Ramadan Kareem to all. Thank you, sir. And thank you, IJCP and